It looks good. I also want to mention that the session is being recorded and will be posted, just so everyone knows. But yes, the screen looks excellent. Thank you.
Okay, so I think we'll be okay as long as we're working strictly with the slides, but halfway in, I'm going to start toggling between the slides and a couple different websites that I wanted to show people. So that may be a challenge. I have a double screen set up, which hopefully won't mess things up, but we'll get to that. We'll get to that when we get to it. So good morning, everyone. Thank you for joining this first session of the day. I'm honored to be here. I haven't previously attended this conference, and I'm happy to see that I'm one of a small number of people that are touching on environmental issues. So I'm very happy to be here and glad to have been invited. So in case you're wondering, maybe you're not sure, yes, you are in the right place. I wanted to assure you that air pollution is very important. It affects all of us and the communities that we serve. Marginalized communities, which is the focus of the sessions today, are more impacted both on a local scale and globally. So I'll hope to convince you of that if this wasn't something that you were already aware of. And that you as public health professionals have a key role in air quality health education. You can really make a difference without even getting really deep into environmental health. There's a few key messages and a few key resources that I did want to share with you today. The topics that I'll be touching on, largely I'll give you an introduction to air pollution basics and who are at-risk populations, and then the nuances and the dynamics of climate change and COVID. And then a couple different websites we'll look at. I'll give you some information on how to access demographic information about communities that you're working in, and then accessing real-time air quality data and health messaging around those data. And then finally, we'll try to pull it together. And I do hope to get some feedback from you on how best to approach these issues, but we'll talk about targeted health education and action specific to air quality and other topics that intersect with it. So a little bit about myself. I am an environmental health scientist. I'm adjunct faculty with UIC School of Public Health in the Environmental and Occupational Health Sciences Division. I've worked 20 years now with the federal government. And as a disclaimer, these are my views, my personal views today as a scientist, as an environmental professional, and I'm not representing the Environmental Protection Agency, Centers for Disease Control, or ATSDR. Excuse me. So first off, overview of air pollution basics and who are sensitive populations and at-risk populations. You may be familiar with the Global Burden of Disease, Injuries, and Risk Factors, the GBD project. It was in the news recently. It's an annual study that literally hundreds of researchers and agencies work on this globally, and they regularly update it. And they look at the greatest risk factors that contribute to premature death around the world. And they recently reported that air pollution is the 4th leading risk factor for early death worldwide. And I'll tell you about the different health impacts that are caused, but this is specifically air pollution. Water pollution also is a factor. It can contribute to diarrheal and infectious disease. So that's other environmental media are important as well, but there's a good reason to focus on air pollution as a contributor to premature and preventable deaths. Air pollution exposure contributes to several different categories of disease. There is an extensive body of scientific evidence showing that breathing polluted air over a long period of time contributes to increased risk of illness and death. And the different health effects that are included are chronic obstructive pulmonary disease, COPD, diabetes, ischemic heart disease, lower respiratory infections, lung cancer, neonatal deaths, and stroke. So these percentages here taken from that global risk factor report indicate what percent of those illnesses and premature deaths had a component of air pollution. And sticking with the global issue for a couple more slides here, in different countries around the world, air pollution deaths and environmental contamination in general is associated with the income level of a country. The death rates from air pollution are highest in middle income countries, for example, Egypt, and many countries across Asia and Central Europe, and Asian countries, specifically India, China, Pakistan, and Bangladesh. And this is because death rates tend to rise as countries become industrialized, so they shift from lower to middle income. And then there's a plateau where environmental contamination and associated deaths from air pollution are at their highest. And then as income levels continue to rise, the death rates begin to fall because air pollution is better controlled and the overall health of these nations improves. This has been referenced in various studies. These particular, the link I'm providing here is Our World in Data, which has pulled it together pretty nicely. And then this next chart, it's definitely a little scattery, but this shows death rates from particulate pollution versus the global domestic product per capita of countries in 2017. And again, this is summarized by Our World in Data. And especially if you look by continent, you'll see that on the left side of the chart, the lower level incomes, the African countries, as they have higher income levels, the outdoor air pollution attributed death rates are also increasing. And then those peak levels where there's the greatest air pollution and sort of a middle level of income, that would be India, Pakistan, Uzbekistan, Ukraine. And then as countries increase their standard of living and their environmental protections, you'll see a decline in those deaths attributed to air pollution. So the right side of the chart, we have a lot of European countries and North America. Excuse me. So when we talk about air pollutants, I hear the phrase toxic soup. We're breathing a toxic soup. Personally, I don't find that very productive or helpful, because I think it makes it seem like it's something that cannot be helped. It's just out of our control. So I'll summarize it for you like this. There are, in fact, hundreds of air contaminants that have known health effects, and they can be metals, they could be volatile organics. The thing is that there's only 6 pollutants in the United States that are common enough, that are widespread enough, and that are understood well enough that we actually got to the point of establishing an air quality standard, and we have widespread air monitoring for those 6 pollutants. And then of those 6, there's 2 that contribute the most significantly to health impacts, both in the US and globally. And these 2 that I'll tell you about now are particulate matter, PM, also popularly known in news reports as soot. So fine particles are referred to as soot, and ground level ozone, commonly called smog. So to tell you a little more about particulate matter, we're talking about particles, aerosols that are several times smaller than the width of a human hair. They're measured in microns. And the smaller particles are PM2.5, are particles smaller than 2.5 microns in diameter, and PM10 are particles less than 10 microns in diameter. The larger particles are released directly from industrial sources, car exhaust, construction dust, farm equipment. So those larger particles, that's called primary emissions, so they come directly from a source. And then the second category, the smaller particles, the bulk of these are actually formed in the atmosphere as a result of chemical reactions between so-called precursor gases. So you have gases such as sulfur dioxide from coal-fired power plants, and emissions from vehicles. These gaseous pollutants have a variety of reactions that can lead to the formation of tiny little microscopic particles. And here's where I'm going to go easy on you. I'm not showing any formulas. I'm not a chemist myself either. So why are we concerned about PM? It is linked to premature death in people with heart or lung disease. PM can aggravate heart and lung function and aggravate existing conditions, for example, asthma. People who are most sensitive to PM health effects are those with a pre-existing heart or lung disease, children, and older adults. And this graphic shows you how the larger particles greater than 10 microns, they generally make it to the upper part of the respiratory tract, and then your body has defenses. The particles that are greater than 10 microns, you have the upper respiratory tract has cilia and phlegm that absorb the particles and move them up away from the lungs. But the particles that are smaller than 10 microns and even smaller than 2.5 microns, they can travel deep into the lung, and the contaminants associated with these particles can cross into the bloodstream. So over the years, we've learned more about the health effects and the dangers of smaller particles. So we've shifted from regulating particles of 30 microns down to 10 microns, down to 2.5, and even the ultrafines that are smaller. Ozone, ground level ozone, not to be confused with stratospheric ozone that I'm not talking about today. Ozone can trigger chest pain, coughing, throat irritation, and airway inflammation. It can worsen conditions including bronchitis, emphysema, and asthma. People who are the most sensitive to ozone's health effects are those who have asthma, children, older adults, and people who are active outdoors, especially workers. Ozone is formed entirely in the atmosphere. There is no industry or car that's emitting ozone. It's formed in the atmosphere when precursor gases react in the presence of ultraviolet radiation. And this graphic shows you the main categories of emissions. Nitrogen oxides, NOx, are emitted largely by vehicles, and then volatile organic compounds, VOCs, are emitted by industry and also by household products and household activities. So this is why you may have seen when there's an ozone alert, they'll encourage people, don't mow your lawn, your gas-powered mower, postpone it until later in the day or the next day, because we want to limit the amount of VOCs in the atmosphere and the amount of ozone that's formed. So a couple slides about when it is that these two pollutants are found to be at their highest. Ozone peaks on hot days, so you have heat and ultraviolet radiation contributing to the formation. And the time of day is important too, because a lot of those car emissions happen in the morning and the chemistry and the reactions are going on, causing peaks later in the day. So these two charts show you those temporal relationships. So first we have, this is a standard curve. This is taken from New York City. And this is a chart showing maximum temperature on a given day versus the maximum daily ozone concentration in parts per million. So you'll see that at the lower temperatures, the level, the ozone level, the peak is kind of flat. And then once you start to get significantly above room temperature, sorry, this is in Celsius, but generally, as a rule of thumb, we say that 85 degrees or 90 degrees Fahrenheit is when ozone levels really start to climb. And then the time of day, you'll see these are cities in Japan and Mexico, and it's the same in any type of area that has ozone. It's your peak levels are going to be rising afternoon and peaking around 4 p.m. So when is PM2.5 an issue? PM2.5 can build up the most when we have what's called an atmospheric inversion. And this is a situation that's common in the Midwest, especially in the wintertime. We've had a number of these last winter. And just briefly, without getting into meteorology too much, but normally what happens in the atmosphere is warm air rises, and that causes pollution that's close to ground level to mix and disperse into the atmosphere, both up and sideways. But when there's a thermal inversion, there's a layer of warm air that's very stable. It doesn't allow any mixing. The warm air settles with the cold air underneath it, and then the pollutants are trapped close to the ground. And there are historic events from 100 years ago, from early after the Industrial Revolution, where in London, in various cities in Western Europe, and in Pennsylvania, in the U.S., where you'd have these industrial towns early along before there were environmental controls, and there were events where you would have an inversion for several days and pollutants not dispersing, and people having significant numbers of deaths and heart and respiratory effects. So if when I refer to inversions later, this is what I'm talking about. Okay, so a little more about who's at risk from these different pollutants. The EPA researchers found that the strongest predictor of PM2.5 exposure in the US is race, not poverty. They reported that non-white people face higher exposures to PM than white people in all but 4 states. So those where that's not the case are in blue. People of color living in Indiana and Alabama had the greatest disparity. They were found to be exposed on average to roughly twice as much PM as white people in those areas. And then getting back to the global picture, the Global State of the Air report included this information here: global air pollution related deaths versus age. And you can see that infants and young babies, they have it broken into early neonatal and late neonatal, can be very susceptible to particulate matter. And then that trend also is seen in the older ages. So above the age of 40 and 50 and peaking around 70, 75 to 80, that's where there's the most likelihood of death attributable to PM exposure, as well as ambient ozone for those older ages. This chart also includes household air pollution. That refers to the largely cooking and heat burning of fuel that especially in the lower and middle income countries, where people are using these heating products and cooking fuels in the home that are contributing to particulate matter, not ozone. That would be more of a PM issue, as well as some other gases. So, and that's another one that's seen to drop with income level. So that's the extent of what I had as background. John, are there any questions in the chat? Any general questions about air contaminants I could touch on right now?
There aren't any questions yet, but I'll keep you posted.
Okay. All right, so the next few slides are, a lot of this is emerging and difficult material to talk about because I'm referencing government sources. And as you know, a lot of government agencies in recent years have shied away from doing climate research and putting it on their websites. But I'll put what I've got in a few pieces of food for thought in the next few slides. So if you take a look at the CDC website, they have a number of pages that talk about different health effects related to climate change. And some of it has to do with flooding, some of it has to do with increasing numbers of pathogens in the environment. So with the focus on air quality, here's what we have on the CDC website. They indicate that climate change decreases the quality of the air that we breathe. Climate change is expected to increase ozone and or particulate matter in some locations, and a lot of that is in the United States. More and larger wildfires are linked to climate change as drought conditions become more common. And another thing that, this isn't something I'll get into too much, but just keep in mind that there is an overlap here. Climate change leads to, there's a greater amount of carbon dioxide in the environment, and carbon dioxide causes plant growth, including allergens, to increase. So, as temperatures increase, there is an increase in allergens, and allergic reactions can become more severe when people are at the same time exposed to air pollution. So these two factors, allergic response and irritation from air pollution, can have a synergistic effect. There was a study I came across, here's a short reference to it. They found that climate change causes greater, more frequent super pollution events, is what they called it. And basically what they found is that they saw a 50% increase in extreme weather events in the last 60 years in mid-latitude regions. So these extreme events are summer heat waves that cause a greater number of high ozone event days. And then they also reported a greater number of winter atmospheric inversions. So more of those days where the atmosphere is still in the winter, the pollution is trapped close to ground level. So they documented this as a phenomenon happening in the mid-latitude regions. So that is all of the United States, that is much of Asia, all of Europe, and then also presumably this would be a factor in the southern part of South America, tip of Africa, and parts of Australia too. So wherever it is that they have distinct 4 seasons, it is a likelihood that these extreme weather events are contributing to more ozone in summer, more PM events in winter. So who is the most vulnerable to air pollution effects related to climate change? The American Public Health Association, I'm flubbing the acronym, but they have a page on climate effects and who's the most impacted. They talk a lot about flooding and hurricanes and all the other elements related to climate change. I've pulled out some of the information they had specific to air pollution, and they've identified the most susceptible groups as children. And this is because their organs are still developing, their immune systems are still developing. They breathe more air per kilogram of body weight. This is something the EPA's Children's Health Program, that's always one of the first points that they make, that it's children, because they're smaller, they're breathing more quickly and they're drinking more water and they're eating more food. So all of their exposures, air as well as other media, their exposures are greater per kilogram of body weight compared to adults. Additionally, they spend more time outdoors and they're more dependent on adults to manage their schedules. So the impact to children is largely those that have asthma, those that have allergies, and then older adults are at risk because their immune systems may be slowing down. Many older adults have pre-existing conditions, heart and lung conditions that I mentioned. And so how is it that climate change affects them? They are most at risk with effects on their heart, so heart disease. The APHA did not, they didn't list air pollution under the risk factors for communities of color and for lower income communities. That may change. That's something where other agencies and other organizations are making that connection clear, but so I've kind of extended it a little bit here. From what they had on their website, communities of color are at risk because of structural racism, inadequate infrastructure, and existing health disparities. So this is why communities of color are at risk for hurricanes and floods and other effects of climate change. And I would say that also that applies to their increased exposures and risks from air pollution. And this website called out specifically that they could be at risk for effects on their heart and lungs. And then low-income communities have less resources and they don't have a means to evacuate. So I mean that could refer to evacuating from a flood or hurricane, but also wildfires, I would argue, because there's when we had week upon week of wildfires and dangerous PM levels out in California and Oregon, some people were able to drive, to pay for a hotel, and to stay someplace away from the smoke plumes for a few days, or they were able to install filters in their homes to clean their air. Okay, so as I mentioned, government agencies, this one has not been updated, but in 2016, there was a joint report by 13 federal agencies, and the sections related to air pollution and health effects were, of course, largely derived from Environmental Protection Agency and CDC authors. And so here's a link to their study, Impacts of Climate Change on Human Health in the US, a Scientific Assessment. And so they pretty specifically draw links between social determinants of health and people's vulnerability to climate change. If we take a look at this chart for a second here, down the middle we have climate drivers, which is changes in climate. It's the increased flooding, temperature extremes, and then the exposure pathways. How are people exposed to contaminants? And then what are the resulting health impacts? So we talked about the effects on the lung, effects on the heart, and then how are able, health outcomes would be how people are able to get treatment and get resolution for these health issues. So at all of those steps, there are increased risks and vulnerabilities for people of color and for impoverished people in the US. So in terms of exposure, people in poorer neighborhoods are more likely to be exposed to climate change health threats, specifically air contaminants, and then exposure pathways and health impacts. People with chronic medical conditions are more likely to have a serious health problem during a heat wave or during a high pollution event. And then ultimately, what's the outcome? People with reduced access to care and preventative services are more likely to have a severe health outcome from their illness. Okay. So focusing for a second on wildfires. US wildfires have an unequal effect on minority populations. Here's one of, there have been different specialists have documented this, but here's a reference to one particular. Researchers at University of Washington and the Nature Conservancy took census data and they developed a vulnerability index to assess wildfire risk in communities. Their results showed that racial and ethnic minorities face greater vulnerability to wildfires compared with primarily white communities. And again, in 2020, there were millions of people who were exposed for days on end to extremely high levels of PM2.5. This publication's from before then, but I think it puts in context a lot of what happened this year. Okay, and then a couple more slides about who's at risk. There is emerging research which links air pollution to COVID-19 deaths. Researchers in this particular reference here, they evaluated COVID-19 data and PM air quality measurements. So they largely this was satellite data that they used. And they found that COVID-19 infections and air pollution together cause excess mortality, specifically from cardiovascular and pulmonary diseases. In this study, the percent of COVID-19 deaths that they attributed to poor air quality as a contributing factor, 20% of the deaths from COVID in East Asia, 19% in Europe, and 17% in North America. And the reason for this synergistic effect is that both PM2.5 and the SARS-CoV-2 virus cause vascular endothelial dysfunction. They cause oxidative stress. The body's inflammatory response is promoted. They cause thrombosis and an increase in immune cells. So those of you who have a stronger medical background than I do can probably see that a lot of the health effects, the irritation that we talk about with PM2.5 and ozone, what we know about COVID-19 health effects and symptoms are similar. So they do have a synergistic effect. And then the question is, how does this all come together when we talk about populations who are at risk? So I have not seen documented information that pulls it all together, not just yet, but I know that there are people looking at it. They're looking at the connection between air pollution, systemic racism, and COVID-19. And so just to summarize the items that are interacting, the CDC has confirmed this. These are, you've seen the reporting on this, and I know we have other people talking about this today. CDC has confirmed that Black and Latino communities have experienced some of the worst effects of COVID-19. They're 3 times as likely to become infected as white people and nearly twice as likely to die of COVID. Also, many studies have documented that communities with more Blacks or Hispanics have a higher air pollution just in their long-term background. So we already know that these first 2 factors have some interplay. And so new research shows that high exposure to air pollution can increase the risk both of contracting COVID because the respiratory system is stressed, it's susceptible to infection. And this has been documented previous to COVID. And now that we have this novel disease, it's one of different infectious diseases that is affecting a sensitive respiratory system. So people who are exposed to greater long-term air pollution are more likely to contract the disease and to have worse outcomes. So future studies, there's work underway right now, will be pulling all of these different factors together. So be on the lookout for that. And I give a reference here to a specific researcher at Georgia State University who gave an interview to Mother Jones that was pretty good at pulling it together. Okay. We're going to get a little complicated now with looking at websites. So let's take another pause to see if we have any questions. Okay. All right, well, wish me luck with the toggling. I'm glad that frog left my throat. That was rough for a little bit. Thanks for bearing with me. Okay, so one resource that I really like, the Environmental Protection Agency has a tool called EJ Screen. It's the Environmental Justice Screening and Mapping Tool. This is a tool based on nationally consistent data, and they use an approach that combines environmental and demographic indicators in maps and reports. So it's easily searchable, and I'll show you a little bit and give you a little idea about how to interpret the information. And you can select areas and do searches on just a small census tract size area or a whole county, and there's different standard reports that you can print out. I'll just touch on it briefly though. My main point today is to let you know how to find demographic information if you're working in a community and you maybe you're new and don't know too much about the demographics of the area. So there's the link. I'll go to that in a second. But the different indicators, the EJ Screen tool has 11 environmental indicators, which we will not be using, but if you are interested, they include the one indicator could be the density of hazardous waste sites in an area or the likelihood of lead-based paint in an area. And that's based on the age of the housing and the income level of the population. So there are 11 different environmental indicators. Several of them are related to air quality, but I'll show you a more direct route to get the air quality. And then the others are related to hazardous materials and different environmental concerns. So in my work, I have found those environmental indicators to be very useful together with the demographic indicators to kind of get the lay of the land. If I'm assigned a new site or if I'm asked to answer a question, then it's not always helpful to, if someone says that we have a lot of industry in our area, people's perceptions about what's a lot can vary. So I like to look at the objective indicators of how densely industrialized an area is. And also the demographic indicators. That's what we're going to focus on right now. Okay, the EJ Screen tool has 6 demographic indicators. The first 2 are percent of low income and percent minority. And those 2 factors are taken together, they're averaged together to create the demographic index. The other indices that you might use are less than a high school education, linguistic isolation, individuals under age 5, I have a typo there, and individuals over age 65. So those would be sensitive populations for air pollutants in particular. And just one note about how the data are presented. And so this applies both to the environmental and the demographic indicators. They're all put into perspective by being reported in terms of percentiles. And I know a lot of folks here have taken biostats, and hopefully that's not an issue, but if an indicator is the 80th percentile, then that just means that 20% of the population in the rest of the state or the rest of the country, 20% of the population has a higher value, like a higher percent of low income or a higher density of hazardous sites, whereas 80% have less. So, and that also, the 80th percentile, that's considered, EPA doesn't give official guidance on this, but the rule of thumb is that if any of these indicators is greater than an 80th percentile, then it's worth a closer look. Okay, so let's try to jog over to the website. So that the link that I had on the previous page was an overview and information about EJ Screen, and there's a lot of deeper description there about how to use it and how those indicators are derived. But if you go to EJ Screen, EPA.gov, and then the mapper, this is the actual map, and I'll show you, first I'll tell you what I'm going to show you, and then we'll see if we can do it okay. What I'm suggesting that we try to do right now is let's pull up the mapper, and you can start from the right side. So what I did here is I entered an address, 2020 West Taylor Street, School of Public Health, of course. And then once you find the geographic area, then you can mess around with the different layers that you want to have. So the middle green circle that I showed here, this is add maps. So to start adding layers, you go under add maps, you pick EJ Screen maps, and then there's additional layers that we won't get into today. But if you click on the EJ Screen maps, what pops up is this figure on the left, this window on the left, and this gives you the choice. Do you want to use the environmental indicators, the demographic indicators, or the EJ indices? So what we'll do right now is we'll look at the demographic indicators, and then they're listed below. So the demographic index is the average of minority and low income population. So if I'm still sharing, okay. Can someone confirm for me that your view has switched over to the EPA website that I pulled up?
Not yet.
Okay, maybe there's a lag. Thank you.
It's still not showing. I would
Do I
check the
need to
share.
switch windows?
Yeah, I would check the share screen option again.
Okay, well, we'll give that a second to catch up. I think I did the right thing. But if you start out at that EJ screen link, there's summary information about the tool. And then a little further down the page, there's a box that says launch the tool, and you can click on launch the EJ screen tool, or you can follow the link that I most recently had up. What am I showing now?
It's still the PowerPoint, but I can pull up the EJ screen. And then you can pull up screen sharing when I'm finished with that. And let me know if you need me to navigate to anything.
Oh, this is good. Can I do it or no?
Unfortunately, I don't think so. This is on my screen, but if there's something you want me to do to show the audience, I can do that for you.
Yeah, go ahead and type in the top right corner, find address, type in 2020 West Taylor Street, Chicago.
2020 West, say that again?
Taylor Street.
Taylor. Okay, I think I've got it.
Okay, and then click Add Maps in the middle.
Yep.
EJ Screen Maps. And then select Demographic Indicators. Demographic Index. Yeah, you got it. And then click Add to Map. Yes. And so what we have here, you see the demographic index, and there's a darker orange or red color for the higher percentiles. So John, one more thing, if you want to zoom out a little, there's a plus minus on the left side. Thank you so much. Okay, so you can stop there. So the School of Public Health campus is, you see the red plus sign. So that's in the middle of a yellow section, which tells us that those few blocks in the immediate vicinity of School of Public Health have an 80 to 90th percentile for that demographic index. So that's just at that point of being considered somewhat elevated for minority and low income population. And then if you go further to the north and to the west, you'll get to the darker shade of orange and red. So that's the same kind of display that you'd see for the environmental indicators. Okay. What is that growling? Okay, so you can go ahead and look up another address. So I'm going to get that dog, and if folks can try another address, maybe where you live, where your office is, to see if the numbers match up to your understanding of the area. All righty. Okay, so that's our demo, and that's really all I want to get into today regarding the EJ screen tool. There's a lot of great information there, and I'm happy to talk offline if anyone wants to email me or ask me about the other information that's in there. So next,
I'll stop sharing my screen now.
We can put that away. I have a few more slides on accessing real-time air quality. Should I be sharing now?
Go ahead, you can share the screen, yeah.
Okay. Okay. Oh no, I went to the beginning. Okay, because toggling between the one and the other is a hassle, I'm going to not do any more toggling right now. But, okay, I'll tell you about how air monitoring happens a little bit and how you can access it in real time. So do we have a photo in my PowerPoint up on the screen?
Yes.
Okay. So this is a typical, maybe a little on the heavily technological side. This is an outdoor air monitoring station. And so those various monitors that you see there, those are different types of PM10, PM2.5 air monitors. And there may be other kind of monitoring going on that that's not as evident. But this is a typical air monitoring station. And these data are collected over the long term, and they're quality assured, and they're used by state regulatory agencies to determine whether a given county or sub-county is meeting the EPA air quality standards. So it's used for regulatory purposes, and also real-time data is available for public information. So that long-term regulatory information, this is the current status of our attainment or whether we're violating those air quality standards. So the PM2.5 standard right now, even though we have some peaks in the wintertime that we should be concerned about in terms of people's exposures, it's largely, mainly it's multiple counties of California that are currently violating the PM2.5 standard. In the Midwest, especially the lower parts where it gets hotter, we are in non-attainment. We're not meeting the ozone air quality standard in multiple counties around Chicago, and then the extended area around like Michigan, Detroit, Cleveland, St. Louis. So definitely in the Midwest, and then there's many other parts of the country, the East Coast and the South, where you have large urban areas with hot summers, and we are exceeding the ozone standard. So the Air Quality Index, this is an excellent tool, and we'll talk a little about it, and I hope folks really think about how they could use this in their everyday life and in their work. The Air Quality Index is developed by EPA and state and local partners. It tells us how clean or polluted the air is and what associated health effects may be a concern. So we think of the AQI as a yardstick that runs from 0 to 500. The higher the AQI, the greater the level of air pollution and the greater the health concern. An AQI of 100 is equal to the air quality standard. So PM2.5 and ozone are measured in different ways. They have different standards, but the AQI puts them on an equal footing where 100 is the level of those two standards. And this is what the display looks like online. So a little more about...
So sorry to interrupt. There's a question in the chat. I'm not sure if it was for a few minutes ago from Lori. When looking at map data for NATA and ATA cancer, how do we find more granular data that drives the map view?
Oh, can you email me, because that's the EJ screen pulls this information from different places, and NATA has its own website, and you can get very detailed information. I love that tool. We don't have time to talk about it today, but NATA talks about long-term cancer and non-cancer effects from many pollutants beyond, from the air toxic, so many pollutants beyond the short list that we're talking about today. Yes, it is available. You know, let me make a little note. Maybe I'll try to pull it up when we're done talking about these. But yes, do follow up on that. That's a personal favorite of mine. Okay, getting back to the AQI. So 100 is equivalent to the standard. So yellow The code yellow moderate is from 50% of the standard up to the standard. So at that point, air quality is acceptable for most people. However, there may be some exceptionally sensitive populations who may need to be more careful. Once we get greater than 100 or 150, there's the messaging is provided here. It's on the website. But initially, it becomes a problem for sensitive groups. So children, older adults, people with lung and heart conditions. So when we're at orange, level orange, unhealthy for sensitive groups, it's the sensitive populations we're concerned about. And then you can get up to unhealthy, very unhealthy, and hazardous, where it's increasingly harmful to the general population, not just those with pre-existing conditions. So the AirNow website, they provide real-time data, and they also can predict 1 to 2 days in advance what the conditions will be. So anytime that you pull up this site, you'll see current air quality, and that's real-time coming from those monitors all over the country that I showed in the photo. And then on the right, you have today's air quality forecast. So that's the prediction of what air quality we're expecting. So let's take a look, and you know what, let me jump through the slides and then we'll go to the website. But the main site is airnow.gov, and it's maintained by EPA and different regulatory agencies. So every state does its own predictive computer modeling to estimate what the conditions will be. And then there's also an app. If you have an Android or an Apple phone, you can search for EPA AirNow is what it's called. That's the logo on the left. And then on the right, this is what the display will look like on your phone. So you can have, and you can look at it any time of day. You can look at your location or search another location. So we will go through a demo, but let's first look at what else I wanted to show you. So yes, before we do the demo, targeted health education and action. And John, how am I doing on time?
You have about 20 minutes for the session. We're done at 10:55. Okay,
so I should leave time for some discussion?
That would be good, yes, thank you.
Okay, I'll try. Okay, so to recap, who is at risk from air pollutants? Children and older adults, people with pre-existing heart and lung conditions, communities of color and low income, and people who work outdoors. Okay, I have a few different studies here. The AQI, this tool has been around long enough, and people have been studying different populations who are sensitive to air contaminants, that there is some growing body of information about how successful, how well these tools are working. So here's a few that I wanted to bring to your attention. First, people are more likely to follow recommendations, those health protective recommendations in AQI, when they know where to find the AQI, and if they understand that their symptoms may be related to air pollution. So if they make that connection that, oh, I'm asthmatic, or oh, I have a heart condition, and this air pollution situation is something that matters to me. It's not something that's just out there and it's just a thing. It's something that actually makes a personal connection. So it seems obvious, but people may not necessarily link those things together. Next, receiving advice from a health professional clearly increases the impact of media alerts, and it fosters better decision-making about engaging in outdoor activities when the air quality is bad. This has been shown by a couple different groups of researchers. And so it's wonderful that you may have an air quality alert. The weather report the night before, they may say tomorrow's an ozone action day, or however they do it. Personally, I don't watch the local news. I don't read the local paper. I'm always focused on national and international stuff. So that would probably miss me. And I don't know who really watches the news. If they do, then that's great. But you as public health people should be aware that it's one thing for people to hear this from the weather report, but to have it reinforced by their doctor or by someone they work with in public health can reinforce the connection to their own health conditions and their own actions that can be taken to protect themselves. Next, the majority of surveyed health professionals did not report talking with their patients about limiting their exposure to air pollution. Environmental health issues are probably not covered very much in medical school. And I think I saw on the DePaul website that I believe that's a core class. Environmental health is a core class of the master's program, and that's great. So I'm glad to hear that. But it is something that even if that's not your specialty, whatever your specialty is, this is an important aspect to pull into your everyday work. And finally, health messaging is not equally received by all people who are at risk. Those who have lung disease, and I think this has been popularized in people's awareness, those with lung disease are more likely than those with heart disease to be aware that they could be affected by air pollution and to make changes to their activity level to protect themselves. So that's an area, people with heart disease, seniors, older adults, I think that's an area where there needs to be more work to let people know about the risks. So, okay, I'll flip through these slides and then we can go to the website. There are several different categories. I mean, there's really just a wealth of information. I went into detail with you about the ozone and particulate matter and the communities at risk. This AirNow website has a lot of resources and they're specifically tailored for different users. And the first thing that we'll take a look at is if you go under the education tab, scroll down, there's information for health professionals. And this is the nexus between CDC, health agencies, and EPA, other regulatory agencies. This is where they really work together. I'm giving you EPA links, but a lot of this information is also on the CDC website. So this is the overlap between environment and health. And I hope everyone today sees some opportunities to take that and run with it on the health side, because there's a lot of useful information. So there's actually continuing education credits for medical professionals. There's a unit on PM, there's a unit on ozone, and then there's a unit on wildfire smoke. There's all different kind of fact sheets and posters to share with patients, to posters to put in doctor's offices. And so if you're dealing with one of these sensitive populations, it would be very helpful to have some of these flyers in your office, on your website, however you can get it out to people. So in a few minutes, we'll hop back. We'll look at that website. And I'd just like you to think and give me any suggestions, because this is something I could do in my everyday work. How do we encourage specialists to take those continuing education credits, to use that information with their patients? And what opportunities do you have in your networks? What organizations should we be tapping into? EPA also has a lot of outreach programs to reach schools, to reach children. They have an air quality flag program. And the way the program works is the school, or it could be a local library or a different organization, they check the forecast, they check the AQI, and they raise the flag to let people know what the air quality is expected to be that day. So on unhealthy days, your organization can adjust physical activities to help reduce exposure and keep people active. My husband is a youth soccer trainer. And so if he's doing one of his summer camps, he'll ask me, the resident specialist, is there high ozone today? What should we do on regular practice? Or do we need to scale it back a little to do more, less running, more breaks, more water breaks? So this is, schools are one way to reach the younger population. But what else should we be doing? School, in our part of the country, we're most concerned about these peak ozone days. So July and August, our kids are not in school. So what are the alternatives? What are the different ways that we can reach organizations, networks, school camp programs? There's, I hope you're thinking about different modes of reaching people who are working with kids as a sensitive population. And when we look at that website, you'll see they have a little coloring book for kids. There's a little lizard character named Coco who changes color along with the AQI. There's also higher level information for preteens and for teens. And then older adults. Another part of the website, they have some fact sheets. These could be used in long-term healthcare facilities, different entities that work with seniors can have these flyers or posters up, and people who work with seniors can have an important role to adjust activities in their communities to make sure people are being healthy and exercising, but not putting themselves at risk. So question to you is, what are some good ways to reach older adults and their caregivers? The younger generation, have them put the app on the phone, have them get the notifications. But if we're dealing with an older population that's not as tech savvy necessarily, then there might be other approaches. So a few final thoughts. And we have a few more minutes, so we will go back to that website. Another thing I'd like people to think about, again, we're not all going to end up working in environmental health. We're not all going to be focusing on air quality as one of our main focuses as a professional. But let's think about ways that air quality and protecting people from its health effects, how can that be tied in and connected with other existing programs? So if you're working on there's a local health department I worked with last summer, not this summer, where they had they had a monthly farmers market, and they took that opportunity to have health department information about healthy eating, diet, exercise. And to me, it seemed like a natural extension to also have AQI information, because you want people to be healthy and to exercise, but be also aware of the air quality. This was an area that was susceptible to ozone. And so you definitely want to get out and get your fresh air and get your steps in, but do it on a day when you know the air quality will be good. Schedule yourself so you're doing it. If it looks like it's going to be a day of poor air quality, then stick more to indoor activities and reschedule anything strenuous. Now, in the days of COVID, people, we need to be social distancing and continuing to educate people about hand hygiene and social distance and mask wearing. So together with that, when we're encouraging folks to get out and exercise and to be safe and to prevent infection, also avoid air pollution. So scheduling activities, and then even smoking cessation. If we're trying to protect your lungs and your health and improve your heart, so people need to quit smoking, and also be aware of how air pollution could be continuing to affect your lungs long term. So this is just a few points about different health promotion efforts that you may be involved with, and just be advised that you can loop in air quality issues, whatever topic you're working on. So conclusion, I just, to summarize, public health and medical professionals have an important role in reaching people who are the most at risk for air pollution and health effects. AQI resources are available for various audiences, ranging from grade school kids up to doctors and nurses. And the tools that are available are there's the Enviro Flash notification that I'll show you in a second, and the AirNow app. These are easy to use, and they can be incorporated into all different kinds of health promotion programs. So action items, please go ahead and put the AirNow app on your phone. Recommend EnviroFlash, which I'll show you in a moment. Recommend that to a friend who is at risk or a family member who may have a health condition. And then consider how to incorporate AQI into your regular health education programs in the communities that you serve. Recommend AQI resources to a colleague. You may be working with someone or know someone from school who could even use it to a wider benefit. And finally, once you start using these tools, you'll see that there are likely to be some high PM, high AQI events in the winter time when we get those inversions. Right now in the fall and spring both is when we don't have a whole lot of air pollution because the atmosphere is always moving and we don't have the heat or the inversions. But maybe put May 1st on your calendar because that is the beginning of ozone season. We literally call it that from May 1st through the end of September or maybe partially into October. That is when the agencies do ozone air monitoring. We don't even do it in the wintertime because it's just not a factor. So remind yourself when we get to the spring and early summer that ozone season is getting started. And so even if you forget about this for a while, give yourself a little reminder and refresh your memory, and people that you're working with next year, let them know that it's something they need to look out for. And you can feel free to email me with any follow-up questions if you're interested in what I talked about today. And then also, I'm really into global health, Eastern Europe, and other parts of the world. You can follow my Twitter at Motinka. And so I will jump out of here and let's go back to the website. Let's see if I could do this myself, John. Okay.
Yep, looks good.
Oh, wonderful. Okay. It's still better than jumping back and forth, so I feel good about that decision. But here's the main AirNow website. So does anyone know, can you give me an area code from California or someplace out west? Oh, I can just type in the city. So let's see what it looks like in Los Angeles today. Okay, Los Angeles is currently at a low moderate, so that's good. And then look down here. So this is a real-time map. Current conditions. So yeah, Los Angeles is looking okay. If we go to the north of there, there's some orange and red. I wonder if that might be fires. Let's try another one. San Francisco is good. Okay, well, I don't know my geography too well in California, but yeah, you can see if you look at this map here that Fresno's got some orange. What happens if we click on it? Oh, and I pulled up a real-time map. I didn't mean to do that, but yeah, so let's zoom out a little bit. Please check out this website. It is really informative. When there were the fires in Oregon and California, much of this summer, they were in the, not just the red, they were in the purple, they were in the maroon. You probably saw it on the news reports that they were off the charts for the air quality index for a long period of time. Okay, I need to get back to where I was though. Okay, so let me show you where those resources are. Okay, education for health professionals. here are those continuing education units. So please, if you're a healthcare professional, or if you have someone you could recommend this to, there's units on wildfire smoke, particle pollution, and ozone. So it's both to educate the medical professional and also very specific tips on how to discuss this with your patients, including how to tell them about AQI and what steps they should take to protect themselves from exposures. So that's there. And then the FLAG program, I won't click on that one. And then for older adults and air quality. So here's some very brief information. And then there are fact sheets and posters and specific recommendations for older adults and people who work with them. So I dearly hope that you will make use of that information. And yes, one more thing. I wanted to show you how to sign up. Go over here to resources. Here's how you sign up for those EnviroFlash emails. Subscribe to EnviroFlash. There's also an option here, recommend to a friend. So after you sign yourself up, you can actually click recommend to a friend. You can input your mom's or your friend's email address and recommend that they sign up too. But here's subscribe to EnviroFlash. So you can put in your email address, and then you can specify, you know what, let's go to manage my account. So you can adjust it. I had this set for a period of time where it sent me alerts when the prediction was for moderate air quality. And there are times when I would get that notification almost every day. So I got a little tired of that and I switched it to the orange. So now I have it set. I get an email the day before if there's a prediction of unhealthy for sensitive groups, and I get an instant notification in real time if we do get to that point and our air quality is at levels unhealthy for sensitive groups. So please sign up for EnviroFlash, tell folks about it, and